Falawa, kia ora ana, whakalofalahi atu, malo elelei, Lisa Bulavanaka, taloha ni, and very warm Pacific greetings. Nau mai, haere mai, tēnā koutou katoa, and welcome to this presentation for the Porirua General Assembly on climate change Ngāti Toa, Porirua City. My name is Taima Fagaloa, and I have been asked to talk to the effects of climate change on the health of people living in Porirua City. I'm so proud there is a strong united response to climate change through the establishment of this General Assembly, because recent weather events suggest that our infrastructure in its current state will not cope. And when our infrastructure does not cope, the very likelihood of humanity in Porirua City is at significant risk. In today's presentation, I am going to talk about the health effects of climate change. So let's start at home. In our own community in Porirua, during COVID-19, when emergency services and systems were so inundated with an unprecedented event, it was absolute chaos. The confusion and complexity forced community leaders to take charge where services stood side by side with first responders, community, iwi, and their local networks to ensure that support was provided for people in their time of need, because by working together, that's what it was going to take. There are some amazing examples of how communities across Porirua responded. Porirua East providers and services stood up a response that was heralded a huge success. Porirua Bay publishing a report with reflections and learnings from their experience of COVID. Mana Whenua leading a significant health response, ensuring families receive the support they need. The COVID experience continues to have a lasting effect across the world. What have we learned that would ensure we are ready the next time, whether it's a pandemic or natural disaster? How do we ensure that when it does happen, there is no panic, communities and people are confident in what they need to do? However, we should never underestimate how important hindsight is, and that starting at home with emergency preparedness is better than cure. And a few hundred kilometres away in 2023 was government's big wake-up call in terms of Cyclone Gabrielle. And the battle has never ended, with ongoing natural disasters and impact of weather-related events that have continued to pound the vulnerable communities. However, there is a silver lining. Again, as we saw in Porirua during COVID, communities banded together, ensuring people received the health support they needed. Staff from Gisborne Hospital's dialysis unit, most likely risking their own lives to get to their patients. I call this TTKW, the true Kiwi way. We went to patients' houses to check on them, to reassure them and assess their needs. If a patient wasn't home, we left a handwritten letter under their front door. We've never faced such challenges before, but everyone pulled together and went above and beyond in a time when the community needed it the most. With roads to the coast in ruins, patients needed to be transported by helicopter for treatment. Increased incidence of flood events, coastal inundation and coastal erosion associated with the changing climate will affect homes, property, businesses and facilities over time, and will erode the desire and ability of people to remain in affected communities. Displacement can cause trauma linked to disruption and dislocation from familiar surroundings and disruption of social and cultural bonds and the challenges of resettlement. Right now, I don't know what services will be available to me and my family living in Cannons Creek. Where can I access support? Electricity is down, our food is at risk of spoil. I need water for our elderly and babies. What if my father is on home dialysis and he needs electricity to power his dialysis machines? I'm worried that we're not ready. Our EOC and REMO are constantly planning and practicing for all different scenarios. And in the last few months, we have seen a revving up of the need to prepare our communities for an emergency. At our last session, you heard from Erene Vaila'au Akoi, who spoke about the work that the Congregational Christian Church of Samoa, e Whakasa, based in Waihemo Street, Waitangiroa, is doing to prepare their communities and ensure support is available. The ideal is that Porirua homes are fully equipped to be independent, have access to solar, have sufficient water, food and medical supplies for as long as they need. That neighbours are connected to each other in a way that fosters a supportive connection, sharing resources and helping each other. That the community emergency hubs are there to help those in greater need, where shelter, warmth and food is compromised, and where access to medical devices and services can be managed. The hub also engaging support from volunteers and workforce so the burden is spread across many. Climate change is fueling more frequent and more severe weather events, as power outages caused by grid failures are putting at risk people who rely on home medical devices, such as electric wheelchairs, hospital beds, ventilators, dialysis and oxygen machines. When an emergency causes a power outage and prevents the use of a medical device, the primary challenge is the potential for serious health complications due to the lack of necessary medical support, which can be life-threatening depending on the device's function and the individual's medical needs. This includes difficulties managing chronic conditions, monitoring vital signs, delivering critical medications, and accessing life-sustaining treatment. As part of my research, I found some information on food safety and managing the risk of contamination. Education is needed. We heard at the last session a presentation on people growing produce in their own garden as a way of being able to respond to any emergency or pandemic as they arise. Information such as presented by the New Zealand Food Safety Ministry for Primary Industries provides information, but is it in languages that people can understand? In Porirua, we are significantly diverse. We still have people from the Pacific where English is a second language, but we also have a growing new migrant community whose language will be compromised if they don't understand the information in their own language. So disposing of food and collecting kaimoana are critical issues that must be addressed through educational programs to these communities. This is a great resource for people with disabilities because it's all about accessibility. The focus of this plan very much is on the person with disabilities and their support crew. We need to make sure that all our systems, policies and guidelines include disability perspectives. And although this document, as I went through it, focused on what people with disabilities need to do to prepare, there needs to be ingrained and integrated in every system, policy and plan a focus on the need to support people with disabilities. This is absolutely critical. So if I'm running a service or if I'm running a pharmacy, what do I need to know about what the specific needs for people with disabilities is? And I need to be clear about that so I can ensure they receive good support and good service. Experiencing a disaster can be overwhelming. It's normal for you and your whānau to feel upset and physically drained during and after an emergency. A good plan for Porirua should include support for mental health. Porirua is well positioned, given all the mental health and community support services to ensure people receive support. It's about how we develop a plan so providers know where, who, how and what. We have a well-trained workforce that can be banding together to support our communities. In an emergency situation, Porirua city residents can access clean water through the city's water storage reservoirs, which are the primary source of emergency water supply. However, in a major event like an earthquake, the council may need to restrict water usage to preserve reservoir levels. So residents should store a minimum of 20 litres of water per person at home to prepare for potential disruptions. Water can also be accessed from some community emergency hubs, but the ideal is that as individual homes have sufficient water for those who reside in your whare. As I searched the internet for information or plans on how health systems will respond to a climate change event, it was all pretty standard information. However, what concerns me is that we are still part of a district plan, and if you look at our district, which consists of Wellington, Kapiti and Porirua, we should worry about this. Challenges of transport and access to tertiary care services to Wellington Hospital if State Highway 1 goes down is a cause for concern. We will only have access via helicopter. There is no doubt that Wellington, given its coastal location, will suffer greatly. If there are supplies located at Wellington Hospital, then relocation of supplies to serve Porirua and Kapiti should be relocated out this way, if it isn't already. We need a Porirua plan for health emergencies that is holistic in nature and incorporates how partnerships between primary care and secondary services will occur. What services will Kenepuru deliver if transport is compromised because the link bridges between eastern and northern Porirua to Kenepuru are inaccessible? Then how will those communities stand up a response, ensuring they can access medical care support and medical devices, and access to medicine requires some careful planning and partnership with communities in those services. We know that through COVID, the pharmacies responded. This could give us some hints as to how we can plan better, but we need to have that conversation now. Can the General Assembly advocate for a Porirua City Health Emergency Plan that is co-designed bottom-up with local services and communities sharing their knowledge, resources, workforce and supplies to build the best plan? This will ensure we build on what's already there. What does a Porirua City Major Incident Health Plan look like for our families? A successful plan will bring everyone into the room to develop the plan. We must find out where resources and supplies are so we can ensure they are located within our city and accessible to all. And we must practice, practice, practice. I'll leave you now with a quote that Samuel quote. Fia vavai o lo vaa alona o oi, ai fia tuli mamau le tau unga tātou alo whaatasi. If you want your canoe to go fast, go alone. If you want your canoe to go further, let us go together. Ia manuia.